Hey guys, so we're on to video 3. One of the things I want to just say before I get started on Parkinson's here is that just understand about anesthesia, also pain medications, is that because everything is less or uh, deteriorating, or I don't know what the word I want to say, but in the elderly, we see a decrease in a lot of the functions of our major organs. Things are starting to slow down, right? Because of that, anesthesia is going to keep circulating. Same with pain medicines. So it might take a little longer for them to get rid of that. And the reason why I'm saying this is, say you get a question or you see a patient, you have several patients, and you would understand that if the older patient is going to get anesthesia, that they might have a few more issues. It might last a little longer. There might be some problems with the anesthesia because of the aging process. I just want you to be aware of that. There is another thing that I do want to just talk about really quickly, is that if you have a, let me see, I just had it here and I wrote it down for you, is that I wanted to say, oh, here it is that if you have malignant hypertension, where you're having the tachycardia, the tachypnea, and the muscle rigidity, and the high temperature, then there is an immediate treatment that the nurse will get ready for administration, and that is Dantrium or dantrolene injection. This is a skeletal muscle relaxant. So it is going to relax everything because we're having that muscle rigidity. But that is the drug of choice if we have malignant hypertension, is that is what we're going to give. And that is something you probably need to know. Giving you a little wink, wink there, even though you can't see me at this moment in time. So one of the things I'm going to we're going to start to look at is one of the chapters is the Parkinson's disease. Now, we all know that there are I can take my mask off, there are actual movie stars. Michael J. Fox is one that we have known for a very long time to have Parkinson's disease. There's several others out there that are very outspoken and speak up, so that we can help these folks and make people aware of what's going on. Starting out with Parkinson's, let's just start with the first slide. Okay, there we are. It's a chronic progressive degenerative disorder. So it starts out, and unfortunately, the patient or client is going to decline in time. It affects the dopamine producing neurons in the brain. So it's caused by an imbalance of two neurotransmitters, dopamine and acetylcholine. And so we have this going on in the brain, and that's what's going to happen. It's neurological, and we'll see a lot of different symptoms with these patients. We're going to look at those here in just a second. So symptoms occur when about 80% of the dopamine stored in the area of the brain is depleted. So when we get 80% that's depleted, we're going to start to see the symptoms. And symptoms can be partially controlled as long as there's functioning nerve terminals that can take up the dopamine. So let's look at these symptoms. You're going to have tremors. They have these tremors. They can't hold on to it. There's rigidity. You're going to have postural instability, staggering gait, drooling. They'll struggle with speaking, their speech. It's a very debilitating disease process, and very sad. It really makes me sad for folks. as you look at those, you just have to know that you're fearful that they're going to fall because of that staggering gait. So it's so important that they you watch them so that they don't. Safety is huge with them. They will have issues with controlling their muscles voluntarily. It's really sad to see, unfortunately, for folks. So they can really lose a lot of dignity. And so it is so vital as a nurse that we provide and encourage and be there for these folks, because they can live a full life as they go through. There are medications out there that help too. We'll see about them. Click on my thing. Rapid swings in response to levodopa occur, the on and off phenomenon. Parkinson's disease worsens when there's too little dopamine is present. Dyskinesia occurs when too much dopamine is present. And then we have this wearing off phenomenon. So these are things that happen. So let's take a look. So dyskinesia is difficulty performing voluntary movements. They can have chorea. I want you to get used to these terms. It's very important. So look these up, because you've got to know them to identify. It's the medical terminology. So that is irregular, spasmodic, involuntary movements of limbs or facial muscles. Dystonia is abnormal muscle tone leading to impaired or abnormal movement. So they get these odd kind of movements, different things. Full explanation of the disease to the patient. The patient needs to know what's going to go on with their body, what's going to go on with them, so that they understand why they can't control these things. We need PTOT and speech therapy to be involved. This is where we have to get other disciplines involved and work as a team for these patients is so important. There's a lot of different things out there. One of the things is you'll see a lot of discussion about marijuana and Parkinson's disease. Does it work? There's things out there, some natural holistic things that they're looking into and that they say does work. It's kind of interesting. If you're ever really interested to see some of those other things, look at alternative therapies for Parkinson's disease. Just look it up, Google search or search on the internet, and it will pull different things. And it's interesting to watch the videos, because there's people out there that are really working with physicians and scientists to try to hopefully help these folks be better off. So there are a lot of drugs in this little unit, and we're going to start out with just talking about a couple of them that I really want you to know. These are dopamine modulators. And then you have ones that are not, or I won't say that they're not, I take that back. They're different inhibitors. And then we have non-dopamine and dopamine replacement drugs. So I want to look at a couple of the drugs. Mirapex, you'll see. Restless leg syndrome is where you get the Mirapex. I like to connect it to that. You'll hear about restless leg where they can't control that. It's very, very annoying for patients and clients. My grandmother had it. She would talk about it all the time. She goes, I couldn't sleep last night. My restless leg just kept me up. We're going to look at, I want to go through, I know I'm kind of slow moving, it's getting late too, but I do want you we're going to look at levodopa therapy. Levodopa is taken up by the dopaminergic terminal. It's converted into dopamine and then released as needed. So you're going to see the levodopa therapy given. This is as PD progresses, that's Parkinson's disease, it becomes more difficult to control it with levodopa. So they're going to start out on this, but as they get worse, it's not going to work for them. It generally occurs between 5 and 10 years after they start the levodopa therapy. Dopamine must be administered orally, as levodopa and dopamine cannot pass through the blood-brain therapy. So That's an important thing. Levodopa is a biological precursor of dopamine. So what we're doing is we're trying to get the dopamine to be created, right? Because that's part of the problem with Parkinson's is we just don't have enough dopamine. We can't get it and we don't have it. It's less. Remember that first slide? I can go back to it. So levodopa, carbidopa therapy, contraindicated with angle closure glaucoma. That is one of the things, ding, 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 that you have to know is that when we're giving this therapy, it is contraindicated with angle closure glaucoma. Use cautiously with open angle glaucoma. Adverse effects are cardiac dysrhythmias, hypotension, chorea, muscle cramps, GI distress. Okay. I'm just looking through real quick because I want to make sure I cover what I want you to really kind of focus on right now, and we'll go from that. Anticholinergic therapy, sludge is ACH is responsible for causing increased salivation, lacrimation, they start to tear, urination, diarrhea, increased GI motility, and possibly vomiting. That's sludge, but anticholinergics have the opposite effect. They're going to dry everything up. So they'll have constipation, all of that. So if we have this sludge issue, hang on, and I want to clarify this really quickly for you. So if we're looking at this carefully, and I know you hear things outside my thing, I am just quickly looking something up so that I can make sure I'm clear, because I don't feel like I am right now. Okay, so our Parkinson's disease symptoms differ, and we can have acute cholinergic toxicity, or considered sludge. And the sludge is salivation, lacrimation, urination, defecation, gastric emesis, bronchospasm, and bradycardia. So if we have that, then we know that opposite of that is the anticholinergics. So that's why we'll give them, they have the opposite effect. They're going to dry up the mouth, decrease that salivation, urinary retention, decrease GI motility. They can have dilated pupils and smooth muscle relaxation. And so I do want to take a look. So cogentin is a drug that we will give. Antihistamines, Benadryl. Benadryl, we know what happens, right? Diphenhydramine, that is going to dry things up. So cogentin is an anticholinergic drug used for Parkinson's. And we want to avoid alcohol with it. Hot weather or exercise can cause hyperthermia, so we can have an elevated temp if we do those things. We need to be very careful. Tachycardia is a problem, and we can have those issues. So if I'm looking at this, which drug is used for management of a patient with Parkinson's disease is most likely to cause postural hypotension? The correct answer is Symetrol. And I'm going to tell you the drugs I want you to know is cogentin, which is our anticholinergic. And what does it do? Levodopa. I think I missed the question, didn't I? I did. Oh, here we are. So Symetrol is a carbidopa levodopa, and that the carbidopa and levodopa, so the Symetrol or the amantadine, carbidopa, levodopa, and the other medication there are most likely to cause postural hypotension. Write it in your notes. If I give carbidopa, levodopa, if I'm giving Simitrel or amantadine, those are going to cause those issues. When providing the patient to receiving an anticholinergic treatment for the Parkinson's disease, the nurse will include which information? It is so vitally important that the patient, when taking anticholinergics are used for the treatment of Parkinson's disease, these medications should be taken at the same time as other mediations. The medication should be administered at bedtime. Fluid intake should not be restricted as they cause dry mouth, and it may take several days to weeks for the beneficial effects of the medication to become evident. This answer right here is vital for testing, guys. So when we're taking an anticholinergic, they're used to treat Parkinson's disease. They need to be taken at the same time. They need to be taken at bedtime. They need to have plenty of fluid because they're drying, and they probably won't see the benefits of this medication being administered and for several days to weeks. And they need to be aware of that. Okay. So slide 25 is very important to read through it. Okay. We always want to look at the central nervous system, GI and GU tracts. We want to look at their emotional and psychological piece. This is big. One of the things with Parkinson's disease, guys, is that they're going to really suffer body image issues, depression. It's going to alter and change their life and their lifestyle. So it is very important that we look at this piece, the psychological and emotional status. Signs and symptoms of Parkinson's: mask-like expression, speech problems, dysphagia, rigidity of arms, legs, and neck, right? Assess for conditions that may be contraindications always, and definitely give them the education that they need and understanding that they're going through something very major. Okay. Always have them check any medications, anything that they take with their physician, because some things can alter or change others, contraindicated to be used together. Medicines, if given by mouth, can really cause GI upset. Always give these Parkinson's disease medications in general with food, okay? Unless encourage patients lots of fluid, because they're gonna have a lot of issue with fluid. It's gonna dry them up. At least 3,000 milliliters a day, them, unless they can't have it, and the reason why would be for some other medical reason. If they were a C, would be fluid overload. Okay. Just know that if they're taking levodopa, they can have a hypertensive crisis. That's a ding, ding, ding right there. I want you to know that. Patients should be taught not to discontinue any drugs suddenly. You don't ever stop the drugs. If we stop those drugs immediately, deadly. So it's so important they can have versions to that. Medications and do as physician directed. Let's go on down to this next slide and monitor the response of the drug therapy. We want to know, do they have an increase in appetite, a sense of well-being, their mental state is good always? Can they perform their ADLs, their activity of daily living, their activities of daily living? Can they think clearly? Can they express themselves clearly? Are they able? Are they doing a shuffling gait? One of the things that they'll get is they can become very unstable, and they do a little shuffling gait. You'll see it's like a little shuffling. They have a lot of issues with their mobility. And so we need to be very clear and very, it's very important that we express their safety is a big concern. So we need to think about safety. What can they trip over? What can they do? So these are nursing things that we need to think about when we look at Parkinson's disease. Parkinson's disease is a very general, think about levodopa. Think about, I'm going to pop back up on my slides real quick so I make sure I tell you which medications that I really want you to kind of hone in on. Simitrel is one just to look at, and cogentin. Those are the three that I really kind of want you to focus in on for just now. Just understanding what they are. You don't need to be able to regurgitate or tell me everything in memorization, but kind of know what they are and what we need to look at. But with Parkinson's disease, it's just important to understand what's going on with these patients and how important it is with the safety. When we're giving these meds, it causes, we want them to have lots of fluids. That's so important. We take their medications at night. And we also want to make sure that when they do take the medicines that they're on not an empty stomach. Okay. So that about wraps it up. It's very general. There's very few questions on this test, but on the final, there might be some. So we'll discuss a little more further in depth as we move towards that. But for this moment in time, this is what I want you to know. So I hope this helps.